Welcome to the Hormone Health Boss Show, where each week we will explore the tools, strategies, and education you need to confidently advocate for your health, reduce your symptoms, and navigate your journey from peri to postmenopause like a boss. I'm on a mission to ensure all women receive the great menopause care they deserve, because no one should feel dismissed, overwhelmed, or left in the dark about their health. This show is empowering you to thrive in midlife, because just surviving isn't good enough. You have a purpose, my friend, and this world needs you at your best. It's time to thrive like the boss you are. Let's get started. Hey there, girlfriend. Welcome back to the Hormone Health Boss Show. Today, we are diving into a topic that is close to my heart. We are going to talk about menopause advocacy. It is my mission to empower women to feel strong and confident and clear so they can thrive in midlife. So if you have ever felt dismissed, unheard at the doctor's office, or frustrated with the limited care or options, or maybe you're just unhappy. You're just unhappy with the care that you have been getting, then this episode is for you. Have you ever left your doctor's appointment feeling more confused than when you walked in the door? Maybe you've heard things like your labs look fine, or all your labs are normal, or it's just your age, or maybe just eat less and move more. If you just lose some weight, if you just stress less, or there's really nothing we can do, just wait it out and this season will eventually pass. Listen, I have been there. I've been there in your shoes. I have bounced from doctor to doctor. I have heard the gaslighting and personally heard it. And I know my clients have as well. And it's very frustrating. But here's the truth. You can learn how to take control of your health and your menopause care if you have the right tools and the right education and the right support. So let's get started with today's episode and get you some relief. All right, girlfriend, I get asked multiple times a week from my community, from my audience, from my friends, from my family, for a referral to a provider that can help women in peri to postmenopause. And I know you're searching. I know it's frustrating. I know it's hard to find somebody who is going to listen to you and someone who actually knows what they're talking about. So many women bounce around to multiple doctors before they find one that really works for them. And I want to remind you that most doctors are not trained in menopause care. So it's not their fault for this gap in medical education that has occurred, but it doesn't mean that you have to settle for inadequate care or less care than what you deserve. Now, I know that handing you a referral sounds like the easiest solution for you, right? And it might help you in the moment. You may be able to get some care, but it typically isn't the optimal care that you want to get, right? When we talk about normal versus optimal, we don't really want to be normal. We don't want our labs to be normal. We don't want our care to be normal. We want optimal. We want the best care because that's what will help you thrive in midlife. So just handing you a referral is oversimplified. What if you don't jive well with their personality? What if you don't like their bedside manner? What if you don't like the way that they prescribe or handle their clients or the way their practice works? If you really want to get the best care in menopause, then starting with the provider is actually kind of backwards. That's not where we want to start. Just handing you a referral is only going to temporarily help your situation, and in some cases may harm you, just depending on who that provider is. So I have a better solution for you that actually gets to the root of this problem. The answer to finding a good provider actually starts with you, not with them. It starts with educating yourself because you need to go into that appointment prepared and ready to discuss where you want to go with your healthcare, what you want your future to look like, what treatment options you want to discuss. You want to know the right questions to ask that provider to even know if they know what they're talking about. So I want to teach you how to go into your appointments informed and prepared. And that's how you can bridge that gap between your doctor not having enough information or training and you needing to get really great care. That's how we're going to bridge the gap, okay? So let's talk about some actionable steps that will help you advocate for your best care. Number one, doctors rely on data, right? Detailed data from your symptoms and tracking your symptoms over a period of time is going to help give you clear evidence to share with your doctor. So if you walk in and you just say, I'm having hot flashes, but you don't know how often or what's triggering them, or are they around your cycle, or is there any theme to them, then your doctor may not be able to help you as much as if you have this data in your hands and able to show it to them, right? So having 3 months of that data can be really helpful to determine which hormones are imbalanced and which treatment options may be best for your particular situation. Symptoms don't lie. What we want to do is correlate your symptoms and your lab work and the season of life and take all of these things into consideration. So having your symptoms tracked for that period of time is going to be really helpful. Step 2, I want you to know the right questions to ask your provider. You want to walk in that door with very specific and informed questions. Have you done your research on what lab work would be appropriate for this midlife season? Instead of just asking your doctor, will you run labs? Do you know which labs you want drawn and you want to track during your peri to postmenopausal season? Instead of saying, can we run a full hormone panel? Well, what's a full hormone panel? They may run 1 or 2 of your hormones rather than all of the hormones. So it's really important that you know exactly what you want before you walk in there so that you can ask for those specific tests. And the same goes for treatment. Do you know what treatments and treatment options you want to explore with your doctor? You have 15 minutes. If you're lucky, you'll have 30 minutes to go over these things with your doctor. You don't have time to walk in and let them be the one to drive the bus. If you want to be the CEO of your health, you have to walk in with this all ready to go. You want to ask more questions like, how does this treatment option align with current menopause treatment and research? What are the benefits and risks of the treatment you're offering? Every treatment we try, whether it is a medication or it's a different modality, everything has benefits and risks. So we want to be able to discuss this and have a great, profitable, efficient discussion with our provider that we can walk away understanding very clearly the benefits and risks for our particular situation. So again, that's going to require that you have some of this information up front. And listen, I know there's a lot of information out there about peri and postmenopause, and you probably have heard a lot of noise about it, a lot of talk about it, and it can feel like you know a lot about this topic. But right now, if some of the information that I've just shared with you is causing you to think, I'm not sure I know the answers to those questions. I'm not sure I know the right questions to ask or the specific lab markers that I should be advocating for in midlife that are necessary to help decode your symptoms and offer you potential treatment options that are going to work for you, then that brings me to step number 3. Education is the most important thing that you can do to advocate for your midlife health. This is the most important tip that I can give you, I promise. You have to know before you go in if you want to get this optimal care during peri and postmenopause. There's no other way around it. When you understand your body, when you understand your treatment options, you can challenge the dismissive advice, right? When the doctor wants to kind of push off your symptoms, if you have the education, then you can come back to point them to the research, point them to the science-based evidence that shows that your symptoms can be treated. Remember, time flies by in that appointment. We've already covered that, right? You have 15 minutes, maybe 30 at the most. And maybe you've had to wait 3 months or 6 months even to get that appointment. So you want to be organized, you want to be clear, you want to know ahead of time what you want to discuss so that you can drive the bus. So write down your goals, your personal goals, and determine, do you just want to treat symptoms or are you looking to prevent long-term disease? Because the treatment options for that are different. If you have 2 or 3 treatment options research that you want to discuss and pursue with your doctor along with the research to back it up, then you're going to have a much more profitable discussion than if you go in completely blind. So I commonly hear from women that they're very frustrated that their doctor won't run labs or that all of their labs are normal. And that also goes back to, let's talk about some menopause education here, because if you know what labs are normal versus optimal, if you know which labs should be included in your midlife hormone panel or even just your regular lab work, then you are able to be more in control. It'll actually give you a baseline to go from and then a way to be able to track your progress over time. So having a full panel of your labs is really important, but often when we ask our doctor to run labs, maybe they will run them, but they don't run the full panel. So knowing all of that information ahead of time is what is going to be able to get you the answers that you need and to help you feel less frustrated. So I know what you're thinking. You're like, oh my gosh, this is a lot. Shouldn't my doctor know all of this? They should. But we have talked about in previous episodes, I talk a lot about on social media about the challenges that doctors face. Many have not been given the education that they need to be able to help you in this season. I know that sounds crazy, but less than 25% of doctors get any education about menopause care. And when they do, what do they get? It's like a couple of hours. That is the education that they get. So as women, if we want to have optimal care and we want to be the one in control, we can't just leave it up to our provider to drive the bus for our healthcare. If you want to be the CEO of your health and you want to drive the bus for your menopause care, then you've got to get educated. And if you're not confident before scheduling your appointment, then take some time to do the work. I promise it's going to save you so much frustration and disappointment and trial and error, which ultimately is going to save you time and money, right? Finding a good provider is challenging, but it's not impossible. Most GYNs are not menopause experts, even though we think that's who we should be talking to, right? We've talked to our GYN about our hormones our whole life. Going through puberty, having children, we talk about our hormones a lot with our GYN. And so it's the logical choice to start with when we are struggling with peri and postmenopause symptoms. But I want you to remember, they're trained to be surgeons. They are trained with pills, potions, and surgery. They are not the experts in menopause care. So you may have to kiss a few frogs before you find your prince when it comes to a provider that is not only educated and trained, but also aligns with your goals and vision for your future. If you are working with a provider now who seems to be dismissive or unresponsive when you make reasonable requests, then it might be time to find someone new. And you don't need to feel bad about that. We need to all find that person and remember that we might need a team of people. You might need more than one provider to help you in this season of life. All right, girlfriend, you deserve to be heard and supported, and you deserve to thrive in midlife. And all of this is going to start with advocacy and you learning how to advocate for your health. And I'm here for you every single step of the way. So I've created 2 amazing resources for you to help you get started in your journey to feeling like you are more in control, that you are confident, and you have clarity on how to be the CEO of your health. So the first resource is a quick start guide to learning how to advocate for your health in peri and postmenopause. So make sure to grab that. I'm going to link it in the show notes. And in it, I go over the 6 steps you need to take before scheduling your appointment with your provider. And the second resource I have for you, I'm super excited about this one. I am offering a masterclass next week, and I hope you'll join me. In this masterclass, I'm going to share with you my 4 secrets to confidently navigate your menopause journey from peri to postmenopause. It's totally free, but you have to register to grab a spot. So this is for the woman who is in early perimenopause and has no idea what's up ahead, or the woman whose last period was 10 years ago and you thought you didn't have to worry about menopause anymore. It doesn't matter. Anywhere in between, this masterclass is for you. Because if you're frustrated, if you're struggling, if you're overwhelmed, if you feel dismissed, then there's something you can do about it. The first thing is sign up for my masterclass. I want to see every woman thrive in 2025. So why not grab a girlfriend or two and join me live next week for the Menopause Made Simple Masterclass that will change your life. I dropped the registration link below. Space is limited, so make sure you sign up and grab one of your spots. So what will it be? What action will you take this week to be the CEO of your health? Sister, you deserve the best menopause care so you can thrive like the boss you are. Advocacy is your superpower, and with the right education and the right support, you can thrive in midlife. If this episode resonated with you, would you do me a favor and share it with a girlfriend who needs to hear it? Let's empower as many women as possible to take control and be the CEO of their health. Until next time, keep thriving like the boss you are. I'll see you next week.